Hi, I'm Marvin Plackett, and today is Thursday, November 12th. Greetings to all residents, to all staff, to all guests, friends around the world. At this time, we have 9 active cases of COVID at Episcopal homes. Let me break that down. 5 of those are residents and 4 are staff. Of the 5 residents, 4 of them are on our dedicated COVID unit at Episcopal Church Home, and 1 resident is at another nursing home in the metro area. So again, 4 of those 5 residents are on our dedicated COVID unit at Episcopal Church Home, and 1 is at another nursing home in the metro area. Of those 5 residents, they originated some at Episcopal Church Home and some at the Gardens, and so it's a combination. And the 4 staff that have COVID at this time, again, from Episcopal Church Home and from the Gardens, they are all at home recovering at this time, and we wish everyone, all 9 active cases, of course, the best in their recovery. Testing is definitely continuing throughout the Gardens, Episcopal Church Home, and Iris Park Commons, our assisted living. Substantial testing throughout, as is necessary to do our best to control this so that it does not spread further. And then of course we immediately do contact tracing and so on. Limiting any spread is absolutely vital at this point. Because of the COVID cases that we have at this time, as well as the infection rate, the positivity rate in Ramsey County and in the state of Minnesota, only compassionate care visits are being allowed at Episcopal Church Home and at the Gardens. No other visiting is occurring. And so, you know, we have 10 communities at Episcopal homes. So all of our COVID residents right now, as I mentioned, they're at Episcopal Church Home. That means we have no active cases at any of our other 9 communities. But the 2 nursing homes, we have limitations based on requirements from the health department that apply to visitation policies. Here, let me get to the point, and that is that if you're wondering whether or not you can visit at this time, check our website or connect with the leadership team at the particular community where you have your loved one that you want to come visit to get the latest information on what the visitation policy is at this time, all right? Today in the Star Tribune, there were 3 articles on the front page all about COVID. So COVID is certainly spreading throughout, not just the metro area, not just throughout all of Minnesota, but all of the upper Midwest and throughout all of the US. I mean, there is a substantial surge. This is nothing new, right? I know that you pay attention to the news just as I do. There is a substantial surge going on at this time throughout the whole area, throughout the whole country. I'm just going to read a few excerpts from this one article. Again, front page, the title is Record 56 COVID-19 Deaths Reported Wednesday in Minnesota. You know, I sure wish I didn't have to talk about COVID every single time. I wish that I didn't have to talk about it in such urgent terms. But that is the situation where we're at right now. I'll just read a few excerpts. A single day record, 56 COVID deaths were reported Wednesday in Minnesota, one day after the state set new earlier bar closing times and put caps on social gatherings to slow the spread of the infectious disease. The virus accelerating spread is reflected by the increase in the positivity rate of diagnostic testing from 5% a month ago to more than 12% today. 5% 1 month ago. Alarm bells start to go off at 5%. It's now at 12% in the state of Minnesota. Quote from Governor Walz: if we don't make these changes and if we don't change our behavior, we will have 10,000 cases per day, new cases per day. We will have 1,500 people in the hospital, and we will be reporting, God forbid, 50 or more deaths a day, end quote. The latest White House Coronavirus Task Force update ranks Minnesota 10th worst for its rate of new infections. North Dakota, South Dakota, Wisconsin, and Iowa have the nation's worst rates. So the rates are really heading in the wrong direction. They're bad in Minnesota, but they're even worse in all the states that surround us. So not a good situation right now. That's all I'll read. So, you know, Thanksgiving is just around the corner, and all of the experts in this area, because obviously I'm not an expert, so I listen to them. The experts are saying, don't gather. That's what they're saying. And if you must gather, gather in very small groups. And of course, the requirement in the state of Minnesota is 10 or fewer. And even that's a lot, 10. I mean, basically the, you know, if you, I mean, I've heard it on National Public Radio and in a variety of newspapers. The strongest advice people are giving is don't gather for Thanksgiving. And that's, of course, a very hard pill to swallow. And I am not your boss, but that's the advice that the experts are giving. So proceed with extreme caution is the word. This is a serious situation, no question about it. And you, of course, might be a person that gets it and has no symptoms, because roughly speaking, 75%, the experts are saying 75 to 80% of the people that get it either have mild symptoms or no symptoms. But the other 20 to 25%, they have severe symptoms up to and including death. And so you could be a person that you feel like you're immune, or that you are young, it's not going to affect you, or there's just a whole range of reasons to justify one's behavior. But just remember, you can give it to somebody else that can die from it. That's the reality. That's the mercurial nature of this virus. It's unpredictable, and we just don't know, so we need to proceed with caution at all times. You know, as I mentioned before, we can't control all of society. We can't control everything that's happening statewide or in the upper Midwest or throughout the U.S., but we can do a number of little things right every time. What are the little things that we need to do right every time? We need to wear our face masks at all times that we're not in our own rooms or in our apartments. We need to physically distance at least 6 feet apart from one another. We need to wash our hands frequently. If you have any symptoms, isolate in your home, in your apartment, in your room, and get tested. And don't gather in large groups. Those are things that you can do. It's in your power, it's in my power. I can do those things. I can do them diligently at all times, and that's what we're asking of you, to be diligent with those things at all times. And you know, the coronavirus is knocking at our door at all times. It doesn't matter if we are at work or at play or at church praying. The coronavirus, if it has an opportunity, it's going to seize it. And so it applies really in all aspects of our life. I know I'm sounding dire, but that's what the news is, folks. So we're doing our absolute best here at Episcopal Homes to contain it, to keep it at bay. And remember, right now, we only have active cases in one of our 10 communities. So we're really pleased about that. There are certainly some communities, some senior care campuses that have rapid spread right now occurring, and we're fortunate that we don't. Okay, I will not be seeing you until Monday, all right? I wish you well, take care, and we're going to end with some closing words from Chuck Eversman. Delighted to have Chuck with us today. Chuck lives at Cornelia House. Welcome, Chuck.
Back in the old days, a long, long time ago it seems, yesterday, November 11th, was what we called Armistice Day. It marked that Monday in 1918 when at the 11th hour of the 11th day of the 11th month, the guns of the Great War fell silent, ending 4 years of carnage and slaughter. And so began that not quite 21 years interlude between what came to be called World War I and the Second World War. Now, of course, that term Armistice Day is long gone, and we refer to yesterday, November 11th, as Veterans Day. It's become a time thus to remember all veterans, to remember all the men and women who have served the nation through its armed forces. I must confess that I regret just a little bit the loss of Armistice Day, the reference to that specific conflict and the men and women who fought and died in it. But I realize also that nothing stays the same, and we do indeed need to remember all who have served. So, I'd like to read this morning then what is perhaps the best known, the most recognized of all the writings to come out of World War I. It's from the pen of a Canadian physician, John McCrae. He wrote it on May 3rd, 1915, after presiding at the funeral of a friend and fellow soldier. In Flanders Fields. In Flanders Fields the poppies blow between the crosses, row on row, that mark our place. And in the sky the larks, still bravely singing, fly, scarce heard amid the guns below. We are the dead. Short days ago we lived, felt dawn, saw sunset glow, loved and were loved, and now we lie in Flanders Fields. Take up our quarrel with the foe. To you from failing hands we throw the torch. Be yours to hold it high. If ye break faith with us who die, we shall not sleep, though poppies grow in Flanders Fields. And so, once again in these November days, we remember those who have answered our country's call. We give thanks for their service, for their sacrifice. And we pledge ourselves anew to the cause of justice and peace. So may it be.